Morning by the Deputy Chief Medical Officer of Australia, Professor Michael Kidd. We'll very shortly give you an update on the very heartening news from the TGA that not only have they approved the Australian manufacturing processes and production for the CSL program, but that the first batches were approved last night and the trucks are rolling. The trucks are rolling around Australia, which is great news in terms of the rollout. Before that, though, I do want to mention something I think that's of really profound significance of the Parliament coming together. At 9:30 a.m, and that explains the timing of this morning, I will go to the Parliament to introduce the mitochondrial donation law reform, or Maeve's law bill for 2021. Maeve's law is inspired by a beautiful young 5-year-old girl, Maeve Hood. She's from my electorate, but she represents so many beautiful children around the country. Mitochondrial disease can affect many families, and every week there's a child born who will have a severe, potentially terminal form of mitochondrial disease. Maeve is a young girl who was not expected to make her 5 years, and as her parents said to me this morning, every day is a blessing. But this law is landmark legislation. It's being brought in with the support of the ALP, and I particularly want to thank Chris Bowen, who worked very hard on this jointly and quietly behind the scenes with me, and Kylie Wright in my office, and the Mitochondrial Foundation led by Catherine McGovern, and so many parents. But what this law does is it will open the way for mitochondrial donation, firstly through clinical trials, and then subject to those being successful through general clinical practice, to be made available in Australia. It's based in large measure on the UK legislation, which has already been passed and put into practice. And it means that the mitochondria can be provided by a donor, and that what does that mean? It means that young children who would otherwise be born with an inherited genetic condition and have either a terminal or an utterly debilitating condition might be able to live a rich, full life, and that's a gift of life. We know that there will be people with different views, ethical views, religious views, any sort of values framework. And so what we're doing is offering a rare free vote. The Prime Minister, the Cabinet, the party room have all been in support of this, and we've had very constructive discussions with the opposition, and Chris Bowen's passion has been passed on to Mark Butler. And so this Parliament does not see many free votes. But Maeve's law, named after this beautiful young girl, offers hope for every family that might face mitochondrial disease. It's transformative, and a free vote, I think, is when you see, in many cases, the very best of the Parliament. I've had the privilege of participating in some during my time, but it allows everybody to vote according to their conscience, and with the freedom to do so, knowing that their views are sought and welcomed. And these are important moments in the life of the Parliament, and they're important moments in the life of the nation. Now, in terms of the rollout, we've had very good news overnight, and Michael will address this in more detail, but the TGA has approved the first batches of the Australian-made CSL-produced AstraZeneca vaccine. We have over 830,000 doses as part of approximately 3.3 million doses over the next 3.5 weeks. Now, contingency will be held, and so approximately 500,000 a week, or a little bit over that, will go out each week. But this provides the security of supply for the Australian general population rollout, which is fundamental. We've seen global supply challenges. You're all aware of them. and that's both in production, and obviously the EU and the European Commission have put in place some very challenging hurdles. But we are in a strong position because of this Australian production. And just in terms of an update, yesterday was a record day with regards to the Commonwealth aged care vaccinations. What we've seen in the last 24 hours is over 4,600 aged care vaccinations. We have had 45 first dose facilities, 20 second dose facilities, 679 facilities that have been vaccinated for first doses, and 130 that have been vaccinated for second doses. The state and territory figures will come through during the course of the day. And I should say this, that we haven't previously released the fact that now that we've done the numbers, there were 116,000 doses done over the last week. We'd aimed during the phase 1A to have 80,000 doses a week, so that 80,000 has been beaten, and 116,000. And now we will have for distribution and contingency over the course of the next 3.5 weeks, 3.3 million doses, and that will lead to a distribution of, exactly as we had planned, over 500,000 doses a week. So they're very important. We've also received another shipment of Pfizer that arrived yesterday, 159,000 doses. They will be distributed via aged care and via the states. And so the program is accelerating at a significant rate. The other question that I think some of you had asked was about the distribution given the floods. We had hoped that we would have by Monday evening the number of practices that were flood affected down to 50. The trucks rolled through the rain, they rolled through the challenges, and they actually got it down to 38. And so that's a real tribute to our distribution. There are some practices that are still flood affected and in towns where they just simply wouldn't be able to practice, but we'll make sure that they have the doses, and if they need a double dose in the second week, once they're able to practice, that will be arranged. So our GPs are doing a great job around Australia. Thousands of people are being vaccinated, and those numbers yesterday were 312,000, but then a record number of aged care residents overnight, over the last 24 hours, and I think we'll see very significant acceleration in these numbers, exactly as we had planned for this week. Michael?
Thank you, Minister. So clearly the approval last night of the release of the first 4 batches of the locally produced AstraZeneca vaccine is another major step in tackling COVID-19 in Australia. 4 batches totalling 832,200 doses of the vaccine have now been approved, as the Minister has said, for supply right across the country. And of course this follows the approval on Sunday of the manufacturing process by CSL and the earlier approval for the overseas manufactured doses of the AstraZeneca vaccine. The TGA process, looking at the batch approval, ensures that locally manufactured vaccine has exactly the same composition and performance as the overseas manufactured vaccine, the exact same quality, and of course is free of any contaminants. And what will happen over coming months, each batch that CSL produces in Australia will go through exactly the same batch testing to ensure the quality of the vaccine before it's released for use across the country. So as the Minister has said, this vaccine will now be rolling out to general practices, general practice respiratory clinics, and to Aboriginal health services right across Australia, boosting the number of vaccines that we have available each week. This morning I had the privilege of attending the Woonunga Nimicha Aboriginal Health Service in Ngunnawal country here in Canberra, where local Ngunnawal elders received their very first dose of the AstraZeneca vaccine, along with Minister Ken Wyatt, the Honourable Linda Burney, and also Professor Tom Calmer. So they received their first dose today, they'll receive their second dose in 12 weeks. And just a reminder that as well as rolling out this week the vaccine for those aged 70 and above, Aboriginal and Torres Strait Islander people aged 55 years and above are eligible to receive the vaccine this week. A number of Aboriginal medical services have started delivering doses this week, and that number will rise over the coming weeks as well. Thank you, Minister.
Great, happy to take.
Minister, I'm promoted you. Welcome. Minister, you say that you're accelerating the rollout, but you're still well behind what you'd hoped. Do you think you'll be able to catch up on some of those numbers that you'd hoped by the end of March?
We're making progress, and there's no question what we've seen is last week was 116,000. During 1A we were hoping at 80,000. Let's go back, and I think it is important to put the history in context. January the 7th, once we had the affirmation from AstraZeneca that they'd provide 3.8 million before the end of February, that was when we made that, once it was absolutely confirmed. January the 25th was when we revised that, and many people have airbrushed that moment from history. I was here. January the 25th was when we did that, and some have airbrushed that exact moment. And why did that change? Because, as we know, there was a massive global supply chain challenge for AstraZeneca. In the end, we've received 700,000, and we're working on the other 3.1 million, but we're not banking on any of that others. So the decision to create the sovereign domestic manufacturing capability, which was hard fought and hard won, has been fundamental. And we said we'd start the phase 1A with Pfizer in late February, and we did. We said we'd start the phase 1A for AstraZeneca in early March, and we did. We said we would start the phase 1B general practice rollout the week of the 22nd, and we did. The difference was simply that global supply chain element. So we remain on track on all the advice that we have for the first doses to be available to all of the general population that seek it before the end of October, and that remains the guidance.
You said that there are going to be...
What about second doses?
Well, second doses are simply a function of however many weeks after the first doses. So it's a statistical element that AstraZeneca was initially looking at 4 weeks. Globally, that's standard because of the trials and the field evidence has moved to 12. And so wherever you have your first dose, it's 12 weeks after for AstraZeneca, it's 3 weeks after for Pfizer.
You said that there were 3.3 million doses over the next 3.5 weeks. Is that the manufacturing run rate at the moment, or is that the distribution?
No, that's manufacturing. From that we take contingency, which we've always said, because what will happen is when we get to 12 weeks after the first round, we will effectively move towards doubling, and so our distributions over the coming weeks are expected to be over 500,000.
So are you getting any advice on how that could be ramped up, or are we going to see that the manufacturing capability is pretty much going to max out at 1 million a week and it has to stay at that level throughout the rest of the year? Can it be increased?
I know we are actually looking at options. We're looking at options with CSL. We're looking at options where they might have contract manufacturers. Professor Murphy is leading that process, and so we're always looking to expand, but we're being conservative as to what it currently is, and we've got the 50 million doses coming, and we're...
Does a contract manufacturer mean that somebody else will be running a different bioreactor? It's obviously it's a highly biological process.
No,
and very
CSL
difficult
does
to
the...
scale up.
No, this is about what's called fill and finish. So right now, CSL has been focusing on completing this first set of batches, getting the manufacturing approvals, getting the batch approvals, and then this becomes what's called a continuous release process. So as each batch is ready, approved by the TGA, it's then completed and rolls off, so it then becomes a proposition not so much of a weekly release but continuous release. Then the second thing that happens is we're setting conservative expectations on the manufacturing, but I've set out what we know at the moment. But at the same time, CSL is examining what they can do to expand, but we're also looking beyond CSL.
Can I just double check on the way to frame this? Do you think you can go beyond 1 million, or do you think you're simply scoping out whether it's possible to go beyond 1 million a week?
Sounds like the same question put two ways, but that's all right. No, We're considering whether it is possible, and that's, I think, the assessment. But I've got to say, at the moment, what we're looking at is we know that we've got approximately 3.3 million over the next 3.5 weeks. That's a mixture, though, of distribution and contingency. One of the things you see is that you have to prepare for the second doses, where we will go to an effective doubling of the run rate per week. Tom?
Minister, thanks for taking our questions. What's the status of Australia's request to European authorities for PNG? Are they dragging their feet? Is that acceptable?
We would encourage them to support it, and we would encourage them to consider it as quickly as possible. We are working respectfully, but our diplomats are, under the guidance of the Foreign Minister, working directly with Europe and both individual countries and the European Commission. So I don't have an update on a particular response yet, but we think that's very important. It's not the only iron in the fire. We've been working with AstraZeneca that is doing their very best to ensure that there are distributions. PNG is a developing country with a COVID humanitarian emergency crisis. I don't think the case could be any stronger for that assistance. Claire?
The Primary Health Network covering Hunter and the New England region in New South Wales has written to GPs saying that they're experiencing significant teething problems with the rollout to do with vaccines arriving but no consumables or no vaccines at all. They've communicated all of this to the Vaccine Operations Centre, which I think that's what it's called, yeah, that you, as you recommended, I think even yesterday. Are you able to shed any light on how widespread these issues might be? Are you in constant consultation with the VOC? What else are they hearing on it?
So this particular one, and I'll ask Michael to add something, I'm not aware of those details. It hasn't been brought to me. I will say there was an example on Sunday where 4 cases were brought to me by a journalist, all turned out to be wrong. And so
the VOC though, like they're not, this is the actual, that was because people hadn't asked the right questions on a Sunday.
So as of Monday evening, there were 38 practices around the country which had not received, because of flood conditions, the supplies. And we had hoped that we would get that down to 50, but the trucks rolled through the rain. They obviously didn't go to flooded areas or where practices were not in a position to receive, but the advice we have is that there were 38 of those. By definition, some of the ones you've referred to may well be in the flood affected areas. So I'd be happy to receive and review that directly.
Just on PNG, given the EU hold-up and the urgency of the situation in PNG and our sovereign supply and significant scale-up, is there any consideration about gifting some of our own supply to PNG? So
only yesterday we distributed almost 8,500 vaccines, and that will be for health workers. Those vaccines and consumables left with our AUSMAT team, which I haven't had confirmation, but I believe is likely to be on the ground by now. And so we've already done that for the large doses, knowing that PMG will have to set up and run a distribution network. We're working to make sure that we can free these vaccines from our international allocations. We haven't counted those international allocations in our domestic, and so that remains the priority, because this is a humanitarian need, and the idea that others might not support a developing nation in a time of need would be disappointing and surprising, but we're determined. We'll just keep going until it's done.
But is there any plans to give more than those 8,000 that was announced last week?
Well, we're offering 1 million of our allocation of doses. Our priority remains to do it this way, but you know what? We won't leave PNG alone. They stood by us when it mattered. Paul?
What about the US as a supplier of AstraZeneca? Is there any possibility?
One thing I probably won't do is go into individual sources. AstraZeneca has asked us not to do that. The EU part was already public because of the refusal by one of the member states. But we'll just keep going until we get there. And AstraZeneca has indicated that there may be other global supply chain options but our task is to just keep fighting. That's what we do.
On the islands, on the northern exposure.
Claire was ahead of you.
Can I speak on the 500,000 doses from CSL going out each week? Once you've hit 12 weeks, you won't need to keep holding on to half of the doses, so you should then be giving out a million.
Yeah, so the way we do this is you have to build up contingency, because you'll probably end up at more than the weekly production, and then you run it down. So the department has done exactly that planning and preparation. So there's a doubling in what you'd call week 13 of the general population rollout.
On the northern exposure to PNG, there are a couple of islands,
Yes.
top of Torres Strait, they're like 4 kilometres away from PNG, Saibai being one of them. When will those populations, and they're probably only a few hundred people, maybe 1,500 max through the whole region, when will they be
My understanding is that Saibai has already begun its program.
I wonder when they'll be completed, and secondly, when will Australia's Olympic athletes begin to get their vaccines, given the 12-week gap that you were talking about before?
Sure. So two things here. With regards to the Torres Strait Islands, Queensland Health, as part of their program, is ensuring that those islands are being addressed. I've spoken with the Queensland Minister, and we're actually very thankful and appreciative of what they're doing. So that program is underway already, and I believe Saibai was commenced last week, and so Queensland Health could give you the status of the individual islands, but you're exactly right. They were recognised as a priority, and we're focusing on them as a country, but the delivery agent is Queensland Health, but they're doing, in my judgment, everything right. And then the Olympic athletes, that will be considered as part of the program at this stage. We will also see whether or not there is a special contingency which the IOC has available. Previous advice that I had from the Australian Olympic Committee is that they were considering that.
The Olympics aren't too far away.
I'm intensely aware of that, but I won't preempt on particular groups.
Can I ask about one of the models used in the US, which was to use stadiums to vaccinate a whole lot of people? Now, maybe this is not a federal responsibility, it may be something for the states, but do you think that there's any place for that model in Australia?
So firstly, let me make this important distinction. Our vaccination program is about working within the available supplies. And then the question is, in order to distribute those supplies, we have to ensure the optimal way to do that. And I'll ask Michael to add to this. So we work within our supplies, and there are a number of ways you could do that, but there are 3 elements. There are state vaccination clinics, and some of those are using those larger models. The backbone of it, all our medical advice is that general practices, given that not every country has a primary health network that is set up to distribute vaccinations. Australia, because of its diffuse and diverse and regional population, does have that network where our GPs are effectively vaccination clinics in every town and every state. We go from just over 1,000 to 4,500. The focus on the needs of the elderly, the focus on not busing the elderly, the focus on people with disability, and in particular with chronic disease or who are immunocompromised, means seeing their doctors is so fundamental. And then thirdly, there are the Commonwealth clinics. So all 3 of those are being used. But Michael, on the fact that we have a vaccination network and we use it for flu and the National Immunisation Program every year, this has been the strongest possible medical advice.
Minister, gender quotas?
No, Michael.
I think you said it all, Minister. We have an incredibly strong healthcare system in Australia, and the capacity to deliver vaccinations to every member of our community by very well trained and very skilled healthcare professionals. Thank you.
Gender quotas?
I do want to see at least 50%, if not more, of places in the Coalition Party room, in the Liberal Party room, held by women. At the last election, in 2019, the election and the casual vacancies in the Senate, my understanding is that 50% of people who were newly elected to the House or the Senate for the Coalition were female. But we've got more to do. And so whatever way will get us there, I'm very open to that. One way is quotas, another way is active management. Just to give you an example from the health portfolio, I think when I came into office, there were 43% of women on boards. Now it's 57%. We have the Digital Health Agency with a female CEO and a female chair, just outstanding, strong leaders. We have the National Health and Medical Research Council with 60% on its board. Cancer Australia, 67% of women are on its board. The Mental Health Commission, 75% of women on its board.
Party, which is old and very male. So do you support gender quotas? And look at your own state, Victoria.
I support achieving 50% at the very least, and that's been my approach and my record. I'm blessed that I have co-chiefs of staff who are women.
Whether you support gender quotas or not.
I support the outcome, and I'm very open as to the means. And what I'm saying is, when you look at the approach we've taken in health, one approach has been what I call active management. You can either be passive and just let things roll, active management, or you can, if you need to, if that's not achieving the outcome, then the quotas are a possibility. And so I'm very open to that. Now, I will take...
Andrews said yesterday that what's been done in the past hasn't worked, so a new approach is needed. Targets have been used in the past. Do you acknowledge that that hasn't worked?
Well, I think we did achieve 50% in 2019. I think it's very important that we all acknowledge that fact. But the whole message, the deep and profound message of recent weeks is that this Parliament and our party, my party, can and must do better. The 2019 outcome with the outstanding women leaders who came through, I think was a really important step. But that has to keep going. And then more generally, there's a national challenge. And that's our fight. Hopefully, what we've been able to do in health is one small example of how we can achieve this. But the goal is really simple. Total equality. That's the goal. Total equality. And I think on that, I think that's a good note to head to the House and to introduce Maeve's Law. Thank you, everybody.